Blog Talk Radio.
Welcome to Women Who Rock Investigates, where branding just got even better. Our media source provides case studies in the areas of breaking news reports, health policy and government, human resources, and more. Our hand-picked experts provide our audiences with credible information to validate the latest in these studies. Women Who Rock Investigates are heard over most of your radio podcasts, such as Spotify, Google Play, iTunes, and iHeartRadio, just to name a few. We are interested in getting our experts heard around the globe, and we have partnered with Live 365 and Airtime Pro Radio to extend their voices of claims and theories. Join us each Thursday at 10 a.m. Central Standard Time after Women Who Rock with Success. Now, let's go to the show.
And good morning, and welcome to Women Who Rock with Success. This is your show host, Ms. Diane Winbush, and we thank you so much for tuning in with us. We're trying to wait till some of the other guests get chimed in. But anyways, for the last few months, we have been talking about COVID. And of course, there have been a lot of concern. Good morning. Good morning, Dr. Colbert. And so,
good morning.
Good morning. And so we have been discussing that. And then, of course, for the last 4 or 5 months, we have tried to give our audience a better understanding of what COVID is, why, I guess, it's spreading the way that it is, and then also some facts and some tips as to how to go by keeping yourself safe. So we have Dr. Colbert. It appears that the other guests are having problems with dialing into the show, so we're going to go ahead and still get started. And so we want to read this disclaimer first. We want to get started with that before we go into the discussion. So our disclaimer states that comments and facts that are shared by Women Who Rock Investigates and our guest panelists does not affect any bias towards any medical practice, hospital, or professional of those in the medical field and any judicial acts that were passed. So listener discretion is advised because with this today it's going to be maybe just a little sensitive because individuals are wanting answers to several topics, several bills that have been passed, and they want to find out as to why their loved ones are being, categorized in a specific type of area, and they are saying, no, that's not what's going on, but this is what the death certificate is saying. So we have our, I think, third-time guest returning back to the show, and it's Dr. Chris Colbert. And
yes.
Dr. Colbert is the Assistant EM Residency Director. He's also the Assistant Professor of Clinical Emergency Medicine and the Director of Health Disparities. So good morning, Dr. Colbert.
Good morning, and as always, thank you for the invitation.
Okay, great. So we're going to get into explaining to the audience, because I like to follow up and recap with everyone as to what COVID is. Some people just feel, well, it's just a flu, or it's just a virus, or it's just an extension of the flu. So we want you to be able to share a little bit with the audience for listeners that are tuning in that are new as to what COVID-19 really is all about.
No problem. So COVID-19 is a coronavirus. Coronavirus has always existed, and there are different types of coronaviruses. So think of this as there's different types of pizzas. There's pizza with cheese, there's pizza with pepperoni, there's pizza with sausage. So this is a different strand of the coronavirus. This is different than the flu. Under the umbrella of viruses, there are different viruses. There's adenovirus, rhinovirus, coronavirus, and influenza as well. This specific strand of coronavirus has the evidence and proven to have a higher morbidity and mortality than other strains of coronavirus. So when people make the analogy that, well, this is just like the flu, if you're defining this as under the umbrella of a virus, yes, coronavirus is a virus under the big umbrella that reads viruses. But under that umbrella are a lot of viruses. And this specific virus, this specific strand, has the effect of which we are seeing today.
Okay. And so, even with the pandemic, there are other things that have arose in regards to the pandemic, because a lot of things that happen. Individuals have issues with everything that I guess goes on in America today. So this is the next issue, which I thought was kind of strange. But the next question is in regards to the demographics, because it was stated on CNN News, MSNBC, and other news outlets that the most demographic that where COVID-19 is labeled is the African American community. So in your perspective, where have you seen the most that come into your establishment in the hospital field?
So that is an excellent question. In fact, here in Chicago, African Americans make up 20% of the population, and greater than 50% of the morbidity and mortality from the results of COVID. And same with black and brown patients. A lot of this has to do with comorbidities, resources to hospitals as well. So it's a bigger picture than just saying African Americans. It's African Americans and those are different populations that have higher comorbidities, live in specific areas. It's a tale of just medicine in general, and just of human dynamics, where there are specific demographics that will always have a higher incidence or worse sequela from any type of medical pathology due to, number one, comorbidities, hypertension, hyperlipidemia, COPD. Those will always complicate and challenge one's immune system to fully bounce back when exposed to any virus. And coupled with that, it's the resources to hospitals that have definitive management, where unfortunately there are specific individuals of this population that do not have the resources at the closer hospitals, and that also poses a significant challenge for definitive medical management.
Okay. So who do we have on the line with us?
Yes.
Is Dr. Sears with us?
Yes, this is me.
Okay, good morning, Dr. Sears. And so we have Dr. Colbert also that is on the broadcast with us on today, and we're waiting for one more guest. So this is your first time, and so welcome to our Case Studies podcast. And so tell us a little bit about you, Dr. Sears.
Okay, well, I'm I hope I am an expert in inflammation. And so I've been investigating over the last 35 years the role of diet and inflammatory diseases, and COVID-19 is a great example of an inflammatory disease.
Okay, great. So tell us a little bit, Dr. Sears, in your perspective of what you have seen in the latest 30 days. Where are we today in the COVID? Because sometimes we see so many facts that are on the news. Some people, Dr. Falls is saying this, if we don't stop this, then these many individuals are going to perish by the end of 2020. And then you got some individuals, some news reports are saying, it's digressing. Then you have some individuals on news reports, they're saying that we are enhancing. What have you seen in the last 30 days as to where the COVID-19 pandemic is today?
I think we've seen exactly where we have been predicted by the true experts in the field many months ago, that we're into a beginning of a second phase that will accelerate in the fall of this year, and as a consequence, that we'll start to see a new increase in mortality from the COVID-19. This is no different than what occurred in the 1918 pandemic with the influenza virus.
Oh, wow. So you think that we're going to see like a splurge in it? We're going to see a surge, not splurge. We're going to see a surge in the pandemic, you feel?
I think so, and most of the experts in the world of epidemiology would agree with that assessment.
Okay. Dr. Colbert, your take on that?
We've definitely seen an increase in the positive COVID cases. And to put things in context, I believe that the reason why we are seeing an uptick, and it's just not in, that it's just across the nation, is one of the biggest things we're finding is that, if I'm sure that everyone's seen this as well, is that you're having anything that increases the contact and exposure. So we're having an uptick in people going to college and these quote-unquote outbreaks in kids of, we've got different universities, there are 36 cases positive, 2 cases are positive, all that kind of good stuff as well. That does attribute to these newer numbers. And my biggest concern with this is when these kids come home and see grandmother, see aunt, see grandfather, that's where the conflict really takes an effect. And again, it's just important for everyone to stay safe. But yes, the numbers are going up, and there are reasons we can identify that these numbers have gone up. It's not just college kids. There are more interactions, more exposure as time goes on. That is a process of transmission of any virus. Everything, exposure and contact. Yep.
Okay, great. Okay, so I think that we have Jamie. I think her last name is Vesser. I think we have her on the line. Good morning. Okay, so apparently we don't. So to the next question. According to and I know neither one of you all work in this field, but it still is a question that is concerning a lot of individuals because, and I don't want to get into the political topics of that. So we'll just go with the fact that the American Academy of Pediatrics says that since the COVID-19 started, over 500,000 children have been contracted to this virus. So now, if that's the case, do you think that it would be a lot of us, more people that would have the COVID-19 virus, Dr. Sears?
Well, I think we have a disparity between the amount of testing and the amount of people who have actually been infected. That the best estimates are right now that of the 6 million plus people who have been tested positive for the virus, there's probably another factor of 5 who have been exposed to the virus but have not been tested. The fact that you had 500,000 children testing positive for the virus is not unsurprising because they've been they can get the virus. It's just they don't have quite the symptomology that an older population and more inflamed population will have.
Okay. Dr. Colbert?
You can't argue with those numbers. The American Academy, they know what they're talking about. I don't understand even why people even argue and will say, well, no, you can't argue numbers. You can't argue test results. And as an emergency physician, that is what I hold accountable are test results and symptoms, and even you have to err on the side of caution. I think that those numbers reflect the actual numbers, and honestly, I would agree that those numbers are probably lower than what we would anticipate. I don't know how much lower. I don't want to exaggerate and say this is 50% lower, but for every one person that's willing to take the test, I'm willing to say there's a group of individuals who are positive, that are asymptomatic, and some of them that are symptomatic, but just don't take the test. Those are the reasons why these numbers are going up in different areas. It's because you have individuals that are asymptomatic, or some people just don't have really outgoing symptoms, and they're coming in contact with people who aren't.
Okay. So the Johns Hopkins report may be accurate as of today as to where we are in the coronavirus, as well as Dr. Falls. So I guess that could be a great argument. We should not try to say that the numbers are not validated, but it's a possibility that all of these numbers, because individuals are saying other things too. Of course, the media can be able to enhance and blow up things as well and cause Americans to see things in a different way. So, okay, we'll take your expertise on that.
Well, if I may, I think that one of the biggest challenges right now is the lack of public trust. And as an emergency room physician, I can honestly understand when someone looks at me and says, well, you know what, Dr. Colbert, I looked at the news or I went on a blog site, and it's my hope and it's my effort to regain public trust. And because it makes sense to me that people look with a slanted eye at comments made by experts when you have one expert saying one thing and one expert saying the next. So I think it's also our responsibility as experts to ensure that the public has trust in our opinion. And as cliche and as corny as it sounds, that's important if you want to collectively move forward as a community. If you don't trust what I'm saying because the next person is standing next to me that has a white coat and a stethoscope, or because a politician says X, Y, and Z, that's a legitimate reason to say, well, Dr. Colbert, I don't know if I can trust your opinion because this other person said X, Y, and Z. I think in the benefit of community and the benefit of all of us moving forward, we need to sit down and have a conversation of, hey, this is a challenge. Let's address this challenge collectively and have a consistent theme so that everyone is informed, makes intelligent decisions, and it's a benefit for everyone.
I absolutely agree, because Twitter is running rampant as to all of the, the things that are centered around the CDC, the president, and what his comments are, as well as the COVID-19 and where it is. And then the president is telling us, no, the schools are okay, the children are safe, but the pandemic continues to be an issue. I think, I know one of our grandsons had, I think he had. I don't know, he sneezed or something like that, and they sent him home and sent all the rest of his other sisters and brothers home because they wanted to make sure that he was clear and the rest of the children in the home was clear of any type of colds or possible flus or anything like that. So I think everybody's taking the right precaution. I'm just curious as to why it continues to spread as it does. So we're going to get into the next segment, and thank you both for your collaboration on that. So we're going to talk about the CARES Act, and this is something from what I've read online with some articles. This is an act that President Trump signed into office in March of this year, and I think it's in regards to the COVID-19 and as to help hospitals to be able to treat individuals financially, because of course we know that sometimes hospitals can struggle when individuals do not have insurance and what have you. So there's two parts to that, though, and this is no type of I guess I want to say this is no spotlight on your practice as well as Dr. Sears' practice is what he does or what have you. We're just trying to get answers because this is another topic that Americans are just outraged about, and we got to talk about it. And so this is the CARES Act, and so I want Dr. Colbert, if he would, to be able to share with the audience as to what the CARES Act is and why it was signed into office.
Okay, so this is not a new question for me, because I have patients literally come into the emergency room, and that's the first thing they say. I don't want to sign anything. You can't tell me I've got a diagnosis of blah, 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 blah. So, and that's fair. Again, that's fair. That's fair, so let's do this. So by definition, the CARES Act, it's called the Coronavirus Aid Relief Economic Security Act. And in this act, they discuss benefits for unemployment, small businesses, big businesses, and hospitals as well. And under that category of hospitals are a lot of things. It's not just reimbursement, it's it goes on federal and state limits, grants for like 5 years on different topics as well, legal immunity. So there's a lot that's under this aspect of the healthcare like providers. I don't pretend to be an attorney. I am not an attorney. And it's not an easy read. If you really access this and take a look at it, you would read and go, wow, this is the language and how it's delivered is not an easy concept to really grasp. However, it was made in March. Now, that's another thing, too. It's made in March. There are so many things that have changed since March. And so it's kind of like, my analogy is if you notice there's a fire in the basement and everyone just takes everything out of the house. Just hurry up and just grab everything and take it out of the house. And the fire department comes in and puts the fire out in the bathroom. Everything in your house outside in the front of your car with the intent of something to benefit, not losing anything. So now it's easy with hindsight 2020 in September to look back at decisions that were made in March when we had a higher death rate in the ICU, when we were packed in ICU, and New York was a different place, and Chicago was a different place. Look back and say, who would think about that? Well, in March, the world was on fire. You couldn't go to any hospital in Chicago and be admitted. You weren't sitting in the lobby. It was a 2-week death sentence if you were intubated. But now we've come so far at a different place. So I know, and to answer your question, just want to give some context. To answer your question, the common question that I receive is that hospitals profit off of the diagnosis of COVID-19, which I have not seen that documented in the CARES Act. I have looked. I encourage anyone, if they find that, to send it to me. I have literally looked. I've taken the time to read it, and I've taken time to access it. I don't see anything that reads to that content. That's number one. Number two, as an emergency room physician, if someone dies in the emergency room, I don't write on the death certificate, death, COVID. That's just not what we do. It's respiratory arrest. It's cardiac arrest. It is sepsis secondary to pneumonia. I have never, in practice or seen in the ER, seen where we write a diagnosis purely based on a pathology such as coronavirus, pneumonia. It's always sepsis secondary to blah, 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 blah. So in the context and the question of is there a profit based on that, I have never been a part of that. No one's ever communicated to me on a hospital staff and said this is what we write. I have never changed my diagnosis on the deaths in the emergency room, and I have never written anything such as COVID on a death certificate. Does that help?
It does. It does. And so that's the reason why I read the disclaimer before we got started, saying that this does not have anything to associated with any physician or any doctor that is or any guest panel that is on the show on today. So this does not have anything to do with you. It's just individuals have questions.
Oh no!
And of course, go ahead.
I know. I agree. I appreciate the resource to answer this question because, again, my focus is to kind of regain the public trust. And your question is nothing new. That's not your statement. And the question of the CARES Act is absolutely nothing new. People come to the emergency room and say that. They'll call the emergency room even before they arrive to ask and get some clarification. So this is a point that needs to be addressed, and the resource needs to be there for someone to ask these questions, and you provide that resource to your audience. So that's of significant value not only to your audience but also to me to give the opportunity to communicate to future patients or just the community in itself so we can have a better understanding.
Absolutely, because yes, perhaps maybe not in the area that of your demographic, but here we reside in the state of Tennessee, and the individuals are outraged. I'm not for sure as to perhaps maybe some hospitals may, are performing this type of behavior or what have you, but people are outraged. They take their family members in, and they're diagnosed with one thing, but when the death certificate comes out, it has COVID-19, and it's not funny, but I'm just saying. So that's the reason why Americans, because that's the reason why I shared the links with you all, if you all had got that, with the transcript of these news reports from USA Today, and it's on, I think, the New York Times as well. People are complaining, so some hospitals are trying, where they are being accused, I'll put it like that, of taking advantage of the, which we're going to get a little bit into that in the next segment, of taking advantage of individuals or taking advantage of the CARES Act. So your take on that, Dr. Sears, if you will, in regards to that.
Well, I would agree with what Dr. Colbert said. The fact that, if you read the language, there's nothing that basically supports many of the, quote, allegations. We have to also be asking really another question, too, is why, not so much why people go to the hospitals, why the people who become infected don't go to the hospitals. And that becomes a very interesting question, because it's saying that I believe it's a case of the underlying levels of inflammation. Those who basically are admitted to the ICU, those who basically have to go on the ventilators, it's quite clear from the data. They are vastly more inflamed. And so what we have with a virus which is nasty in its own right, we have a really perfect storm. We have a more inflamed population. And this is why one of the great cofactors for hospitalization are obesity and diabetes. Both of these are inflammatory conditions. So in many ways, the coronavirus is almost like the straw that breaks the camel's back. If you already have a high level of inflammation in the body, then the additional inflammation induced by the coronavirus is enough to push you over the edge to get you into a hospital. So this is, we had to affect how do we stop the coronavirus spread, but at the same time, how do we reduce the levels of inflammation in the American population?
Absolutely, and that is a fair question, Dr. Sears, which we're going to bring the next question up to you as to why individuals, as Dr. Colbert had stated earlier, that, it's a public trust issue, but I would not even think about trying to, negotiate my health concerns as to staying at home because I may have COVID, because it is rising in a lot of states, and that's the first thing that Americans, we're not going to say people, we're going to call them Americans, that's the first opportunity for them to do is just to get up and, hey, look, I may have something that may be a little bit different than just the regular flu. I may need to get up and may take an opportunity to see, to check this out. So why do you feel that individuals are fearful? And sometimes what we talked about before, I think that you got on the line, Dr. Colbert had addressed the demographic issue with the African American population. Sometimes they may be in fear of the unknown sometimes. So why do you think that others do not take the necessary steps to check out their health in regards to this pandemic that is continually to spread?
Well, I think we have, like I said, this is a multifactorial situation. We have, in terms of the Black and Latino communities, we already have a significant amount of existing inflammation. That's why they have higher levels of obesity, higher levels of diabetes. So they are basically really an easy target for the virus. So we have to look at this from two standpoints. We have to basically say, what can we do as individuals to reduce not only infection from the virus, and we all will eventually be infected with it, but to reduce the inflammatory insults by the virus. And much of that basically goes back to our nutrition. And then you get into the much more complex problem, the same problems that give rise to inflammation in the lower economic communities are the same ones that are driven by diet. So we have, a very, very messy situation here that has to be addressed both at the individual level and also at the hospitalization level. But so we have a group of individuals, both those who are already inflamed, those who are obese or diabetic, or those who are inflamed because of age. these are the people who are most likely to end up in the hospital, most likely to end up in the ICU, most likely to have mortality.
Okay, that's a fair response. So, Dr. Colbert, back to you. So, do you see more of patients, or do your staff? I want to say your staff see more, you or your staff see more of Americans coming into the hospital with already pre-existing issues. See, because my issue with that is, and others too, if they would have informed the Americans perhaps when this first started to spread, back in the month of January and February of 2020, then, that would have gave a heads up. So do you see more individuals coming into the hospital that already have pre-existing issues, just like Dr. Sears already mentioned, diabetes, different things like that, maybe health issues with their heart, or perhaps maybe already pre-existing with cancer or something like that? Are they more vulnerable because of their immune system that they can be able to contract COVID-19 versus a child that perhaps, I don't know, that's homeschooled? I think some individuals are still, contracting it even when the students are at home as well.
Well, as the previous physician communicated, yes. Well, and let's just for 30 seconds, we're going to push the topic of COVID-19 to our far left or far right, whichever you want to push it, and it's fine with me.
Okay.
But anyone that has pre-existing conditions is always at risk for worse sequelae. So there are people that have heart attacks that don't have high blood pressure. There are people that are diagnosed with cancers that don't have high blood pressure or diabetes. It's that patient population that has comorbidities that are more at risk for a longer go with whatever the diagnosis is, or a more of a challenge to the system. So the concept that COVID has a worse effect with people with comorbidities is just consistent with medicine across the board. So if you had an abscess, let's just say an abscess in your leg, and you had diabetes, the fact that you had diabetes complicates this. If you have COPD or asthma and you have coronavirus, that complicates it because your body already has a stressor. So to answer your question, yes, having comorbidities puts people more at risk to have a more significant effect from any virus, from any medical pathology. And coupled with that, the additional question you asked is, and what was also discussed is, people not coming to seek treatment because they're concerned, and why aren't they coming to the hospital? And again, I'm going to go circle right back to public trust. I have people that call the emergency room and say, hey, I'm sick, or hey, I have chest pain, but I'm concerned to come to the emergency room because I don't want to get COVID. And that's honest. And I totally get that. And I make it my business to answer the phone because it's back to public trust. You can't really complain about the public trust with the way information is delivered. What I can do is hopefully be a positive aspect of this so that the public trust can be regained. People don't come to the emergency room because they're concerned they're going to get COVID-19 from a hospital, which honestly makes sense to me. There's a reason why doctors always wear masks in the hospital, because there's a higher percentage of patients and individuals with COVID-19. However, every hospital has provisions for COVID-19. So you're not sitting in a lobby shoulder to shoulder with other people, so that you are not sitting at an at-risk population. We've decreased those factors to make the pre-hospital experience safer for everyone, not only just patients, but hospital staff. So if you have any symptoms of anything, chest pain, some numbness in your arm, I always suggest to come to the emergency room. We will make provisions so that your medical treatment is expedited, as well as you receive the treatment that you need.
hmm Absolutely, because here in our neck of the woods, what the physicians do on a regular doctor visit, they won't even let you come in. They'll come outside and hand you the clipboard so you can fill it out, and then when it's time for the doctor to get ready for you, then they come back to your car, and they will come and get you. Is that safe practicing? Perfect. Yes, I don't have a problem with that. I think that is the most best way to help social distancing and to be able to close the lobby. They have to do whatever they need to do. People don't want to get sick. People don't want to have the virus. People don't want to have to, be threatened by, to the fact that, if I already have a pre-existing issue, I don't want to have to worry about if I'm going to die if I catch the COVID-19. So are these physicians doing the right thing? You bet they are. I think that is a good practice for them to do. Let them sit outside, and then I'll come and get you, okay? So this is going to got one more question before we close out this segment, and before we get into the next segment, and this is a political one. But like I say, our audience has a very large appetite for questions, and so this is my job to give them what they ask for. So at any time, you all can say, well, I don't want to answer that, or that doesn't pertain to me, and we can move on to the next segment. So according to Politico is an online journalist platform, and they state that, what they're saying, and which other individuals are saying too, as goes back to what Dr. Kober states. It's a miscommunication and also public trust. And so this question is going to be for Dr. Sears and Dr. Kober. They are saying, and people will say anything, but now there's a lot of things that are surfacing stating that the COVID-19, the people are not actually, because that's the reason why I brought you on, Dr. Kober, because you see, not Dr. COVID, I'm sorry about that, but Dr. Kober, you see firsthand of all the patients that come in from different areas, different locations, different demographics in your hospital. So they had put out and said it. Even articles are being published, with the New York Times as well, as to saying that, this is a political blast or what have you. They're just trying to knock President Trump out of the way and saying that he does not know what he's doing, and so we got to spike up these numbers and what have you to be able to come in and distract it. So now Politico has published that President Trump is interfering with the CDC reports of the COVID-19. So we want to clarify some things, starting with Dr. Sears. We want to clarify some things with the people of the U.S., as to this is not something where we're just making it up because even though now, watch this, even though with the Ebola crisis that we had, soon as the president got elected for that office, then that's when the Ebola went away. And so that's what their concerns are. That's what people are trying to, they're trying to surface these allegations around, saying this is like a political boost. There is these numbers are fictitious. These people are not having this COVID-19 and things. We believe that it is true, but we don't believe the numbers. So we're going to start with Dr. Sears to see if he could be able to address that for us.
Well, first of all, the facts don't lie. We rely upon truth from our government, especially the CDC. And you can go to their website and look at excess deaths. It doesn't matter what it comes from, but you can see a significant spike since February of this year, well over and above statistical significance. And so what you're looking at is saying more people are dying in America now than they should be. And we have one basic format saying the COVID-19. The COVID-19 is diagnosed by the blood. Either you have it or you don't. It's like being pregnant. Either you are or you aren't. And so with the significant increase in Americans who are both dying in excess deaths compared to previous years, and those who basically have been confirmed of having the COVID-19, there's a striking correlation. So again, you can run for the facts, but you can't hide from them. And the facts are the facts. And people on either side can try to spin those facts, but we've got a problem. I think in many ways the COVID-19 is just exposing a tremendous underlying problem we've had in America for the last 30 or 40 years, this growing inflammation crisis, and it just now basically brought it to the top.
Okay, so before we go to Dr. Kober, back to you, Dr. Sears. So just like if I walk into a grocery store, most of your grocery stores you can walk in, and as soon as you step on the mat, the door will automatically open. Do you feel that we're going to see an increase in department stores, our local barber shops, our local supermarkets as to how we make contact? Because a lot of times we are using the mask. We're using the mask, but people are not paying attention about the contact. Okay, so if no one is standing on the outside of that door while I'm having to push it open to go to, we'll say, Walmart or Target or what have you, well, not Walmart or Target, we're going to say maybe like a local grocery store. People are making contact. Hundreds and thousands of people are making contact each day. And if that is not being wiped off, is that also something that we should look at as to how we are making contact with supermarkets, retail stores, restaurants that do not have automatic doors?
Well, I'm not concerned about that as much as basically the things we know that do work. It's a respiratory virus. So the things we know that work, and they have worked very well in Europe and other parts of the world, is the old basics. Yes, wear a mask. 2, social distance. 3, wash your hands. It works all the time. It's not high tech, but it works. So before we worry about more complicated things, if we go back to basics, those have worked dramatically well in other countries in the world. We just have not put them in place because we say, for one reason or another, saying it's impinging on my freedoms. Well, we're in basically a biological war right now, so we basically have to treat this as saying we're soldiers in a war and basically do your duty, which is saying the simple things.
Oh, wow, that's perfect response. So, Dr. Colbert, back to the Politico article, and I know it's an article, and I'm sorry. So, back to that as to respond to that aspect as to what Americans feel.
All right, so let's do this. I appreciate the opportunity, so let's do this. So the reality for me is that there is no way that you can talk about COVID-19 with patients, with other colleagues, without the underlying theme of politics. There's just no way to do it. Now it's just interwoven. So, and I think, again, that has to do with the public trust. But there's a way in which this can be addressed. There's just a way in which this can be addressed so that, again, everyone has informed decisions and decision-making, and as well as you can provide information so that it's apolitical. The politicians, high-hitting politicians, they don't return my phone calls. They haven't returned my emails. It's unfortunate. So I cannot speak to what their specific relationship is, because God knows I ask all the time. I'm just like, well, I'm not too sure where you're going with this one, but if you could talk to me, that'd be great. But that being said, there's obvious a slant, and again, I can say this again, whether if you want to go left or right, there's obviously a slant in some of the information. I did not go to medical school to validate why you should wash your hands or wear a mask. That should not be politics. It shouldn't be politics. Okay. It's just good hygiene. It's just good hygiene. It's just good practice, and it's safe practice for everyone around you. In reference to the numbers and how the numbers are slanted, I agree with the prior statements that were made. You can't argue with the numbers. The numbers are going up. The incidence of positive cases are going up, period. There's absolutely nothing more that needs to be said other than, I had 5 patients today. Now, out of the 5 patients, 3 of them were positive. Has this translated to ICU beds? Has this translated to vents? No, it hasn't, and I'm happy about that. Does wearing a mask and social distancing work? Of course it does. Just like washing your hands after using the restroom makes sense. I'm an advocate for patients' health and for enhancing public trust. And by in my opinion, throwing gas on the fire of a pandemic and pushing sides when this is a time when everyone needs to be at least on the same page for health for the community.
True.
I'm more of an advocate for that. Yes, there's without question there's political slant to some of the discussion of medicine, and my role is to focus it on your health, my health, and our health, and moving in a positive direction.
Absolutely. That's a fair statement. I agree with you. So like I stated in the beginning, we're not here to disagree. It's just questions are there. And so we just wanted to bring on the questions and to see if you both of you felt comfortable in responding to them. You can say at any time, no, this is not me. I don't want to respond to that. Let's go to the next question. So because I want to keep you. I don't want you to run away from the podcast. So we're going to eliminate the last segment that we're going to talk about, because that could be something in the area and the avenue of being kind of more kind of negative, because sometimes people will fabricate different things and stuff. And even though if the CARES Act does provide certain things for individuals that are in the ventilators or those that come into the hospitals with COVID-19, I know that some hospitals in our location have went under and have closed simply because they don't have the funding. So that can go both ways. So we'll just dismiss the last segment. So we'll just move to the vaccine. And so where are we, Dr. Sears, today as to the vaccine? So, of course, we're not here doing political, but the president was saying yesterday that, a vaccine may be developed soon, and I think Dr. Falls was saying something in regards to the vaccine as to it may work and it may not work.
Well, I think that's the correct statement. You don't know if it's going to work or not work unless you do extensive testing. There are very few vaccines that are really wonder drugs. The measles vaccine is great. The influenza vaccine, not very good. And again, when you deal with upper respiratory diseases, the vaccines against them are not very effective. It's not to say they don't have some benefits, but we just don't know. So what we have this is a wild card, though. It's been quite shown clearly in terms of influenza virus or vaccines that the levels of antibodies that are produced in normal weight and obese individuals is exactly the same. But the efficacy, the effectiveness of the vaccine is dramatically reduced in those who have excess body fat. And why? Because just having a vaccine is only the first step of a process toward basically being able to fight future viral infections. It's a very, very complex interaction of the immune system, and that can be disturbed by inflammation. And if you're obese or have now a disease that is related to obesity, like diabetes, heart disease, hypertension, then you already are basically diminishing the body's immune system to basically respond to a virus or to respond to a vaccine, to make it unlikely to basically have the more drastic implications of being affected by a virus. So I'm not very enthusiastic about having a lot of the scientific happy talk is saying a vaccine will save us, like Mickey Mouse coming to save the day. It's just not going to happen. But it is part. It's only part of an overall strategy that starts with the basics. Yeah, you're going to basically pay more attention to your personal health. And why? To increase your body's immune response. That's your best defense system. But if you have inflammation in the body, then that immune response is going to be diminished, and therefore the vaccine will have a very attenuated effect. So we have to basically realize that this is a multifactorial disease, and there's no magic bullet on the horizon.
Okay, Dr. Colbert?
It takes years. It takes years of clinical trial studies for someone to any drug company to come up with a vaccination, and that's no secret. That is no secret. There's clinical trials, and after the clinical trials, and under a clinical trial come phases. So there's a clinical trial, there's a phase, and primarily it's based on two things: is the product efficacious, and is it safe? So you can have a product that works, but can you take it if you're pregnant? Can you take it if you're a woman? What are the long-term effects if you are a child? So there's a lot of steps to a clinical trial. There's a lot of phases. Right now there are 3 drug companies that are working on vaccinations. And the comment that was made by the CDC director, Dr. Redfield, was that we could possibly have something by, I think, summer of 2021. I'm happy that the steps are being made moving forward. I do agree that November, December, I've got to ask, how long have you tested this out and what are the long-term outcomes? That's a quick turnaround. I'm glad that we're in a position that we feel comfortable with an option, but it's phase 3, which is the longest stage in these clinical trials. Because the question is safety. I feel comfortable with the fact that they're in a good position to find something that can work as a vaccine. I do believe that November to December is a pretty quick turnaround. It's kind of my analogy is when you come home and your child is in the kitchen just with a pot and just turning stuff in and say, hey, buddy, what is that? Oh, it's ketchup and oatmeal and olive oil and regatta cheese and so do you want to try it, Dad? I'm like, oh, that was great, buddy. But not right now. Why don't you? I'm sure this is great. Let's kind of test it out a little bit more before we start giving it to everybody that walks in the front door. It's still great intentions, and I think there's a lot of positive that can come from that. I would definitely caution jumping on a little bit too early, and I'm sure they're not going to do that. I feel comfortable with saying that this isn't something going to give out to everybody. And in fact, I did a little bit of research. It specifically said with healthcare providers and possibly the military or the at-risk population. It specifically said healthcare providers. And then because then that still goes back into my lab. Would I be willing to take this vaccine in November? Maybe the second person to take it, but I don't know if I'm going to feel comfortable being the very, very first. I do think it's positive. I think they're moving in the right direction, and I think with a little bit more time and evidence and data, I think that we'll be in a better place.
Absolutely, because I was watching one of the reports on yesterday, and I was listening to where they were trying to get the FDA to go ahead and pass it, but I guess they have their concerns as trying to pass the vaccine, as well. So we'll just see how that turns out. So back to Dr., and we're going to conclude this in just a little bit. Back to Dr. Sears. Tell us about your product invention and how you feel that this could be able to maybe, be a support and a help to those that are working on their health.
Well, as I said, the underlying cause of why we get the symptoms of COVID-19 is because our immune system is just not very effective. That's why many people, about 40%, are asymptomatic, but others are not. So this is the whole new field, what is called immunometabolism. It's how the diet and the metabolites of our diet can basically turn on or turn off the immune system. And I think this has far greater promise because this is something you can do today, and it has a safety factor of unlimited proportions. In fact, your grandmother told you this 2 or 3 generations ago. You eat lots of fruits and vegetables. Oh, it's not fun, but it's key for immunometabolism. And if you want to basically protect yourself against viral infections, then basically you have to have a strong internal immune system. The technology is complex. It's more complex than basically going down the GNC and asking somebody behind the counter, what supplement should I take? But once you understand the ins and outs of what you can do, this is something positive. Basically, you don't have to worry about political overlay. It's something you can begin to do today to protect yourself far into the future. And so this, I think, has a greater impact not only on just COVID-19, but across our whole spectrum of health care, which is really, to a great extent, caused by diet-induced inflammation.
And I do agree with the statement that you gave earlier that it's just some things that we should have been doing decades ago. Simple washing of the hands, and also putting your hand over your mouth when you cough, because some clippings and videos that you see on the news reports, they're kind of comical, but it's kind of offensive too. I think these individuals were sitting in a restaurant and someone just coughed and he did put his hands over his mouth, and so all of a sudden an altercation started. They didn't even know who the gentleman was, and they were just they have just been pushing even elderly people, in which I have an issue with that. About putting your hands on people that are older. And so I think, as you stated, both Dr. Colbert and Dr. Sears, that it's just going back to general health practices, washing your hands, and don't try to fight the media or fight the CDC, or don't fight the statistics or John Hopkins reports simply because of the fact of what's coming out. Just do your due diligence of what you are able to do to be able to digress this virus. So with that being said, Dr. Chris, what would you like to leave with the audiences on today?
As always, thank you for the invitation. I appreciate the opportunity, each and every opportunity, to communicate with the audience. I think you do a huge service to your audience, as well as giving them this resource. I'm going to leave with everybody be safe. There's nothing to underplay with being safe. That includes wearing a mask and social distancing. It works. It honestly works. If you have any questions, please communicate with your physician. Communicate with a physician. If you have medical concerns, ask an expert with that topic in mind. Education in that topic as well. In addition to that, if you have any questions, you can follow me on Twitter or Instagram. It's drchris.r for Instagram, and my Twitter is drchriser. NTRCHRISER for Twitter, and DRCHRI.ER for Instagram. Thank you very much.
Okay, you are welcome. Thank you so much for helping us out on the show. Dr. Barry, what would you like to leave with the listeners? And you can also share your platforms, because this can, I know Dr. Colbert is on other different channels with Zoom as well, so this helps the audience to be able to clarify more of the guests, and so they can learn more about the guests as well. We want them to not just the guests to come to the show and the audience just listening to them. We want the audience to be able to connect to your credibility as to your statements of what you have shared and what you'll share in the future in regards to other medical topics. So you can do that at this time. Any websites that you would like to share, any book releases that you have published, you are free to do that at this time. Dr. Sears.
Well, thank you very much, and also thank you for the opportunity of being on your show. Two things I would recommend. My newest book is called The Resolution Zone, which basically goes in the depth and detail of how the diet we consume controls our immune system. If you want to find out more information about the science of what I call the resolution response and its application and applicability to COVID-19, then they can go to my website at drsears.com. On there, we give a lot more detailed in terms of the how the diet can be modulated to basically be your number one drug, as it may be, in terms of basically jacking up your immune system, but also basically what is the real facts, at least from my perspective, of what we're facing with COVID-19 into the future.
Absolutely. So today we have learned a lot from these two doctors. We have learned about what COVID-19 is. We have learned about the CARES Act and why it was established into law, and then we have learned about some simple techniques that we should already be doing, such as washing your hands, covering your mouth, making sure that you're wearing a mask. We have also found out that these statistics are not just statistics. They are real. The COVID is out there. The virus is alive, and it's a respiratory. See, a lot of times, we think that it's just a hand contact. It's a respiratory disease. So we have to keep all of those factors in mind. We want to get the facts. Sometimes the news may get it wrong. Sometimes President Trump, he may get it wrong. We want to make sure we have the facts, and so that's the reason why we had these medical experts here on the podcast on today to be able to help you to get a little bit more clarity and credibility. For our next upcoming show, you can always go to our website at www.womenwhorockwithsuccess.com. And so thank you, gentlemen, for being on the podcast on today.
Thank you. Have a wonderful day.
Thank you very much.
Okay, you do. You're the same.